Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. All right, welcome back to the Equine Vet Connect podcast. We're here in the studio at Countryside Equine Hospital, Old Treatment Room 1. Got Dr. Zoe Latimer with me today. How are you doing today?
I'm doing well. Good morning, everybody.
Yeah, so it's a great morning. If you hadn't figured out, we do these in the morning because we tried evenings one time and it just tanked terribly.
Well, every equine vet, you never know what time you're getting back. So
right.
Yeah.
Let's just do it in the morning. Let's start our day with a little talking, a little educating. It's going to be good. So this was spurred on. You had a pretty exciting weekend on call. And
you could say that.
You're like, hey, Dan, we need to go talk about choke. And I was like, that's a good one. So today we're going to talk about choke. Let's start off here. A lot of people don't realize choke has nothing to do with the airway, at least what causes the choke. It's all about, in horses, it's esophageal choke. So it's chokes in the esophagus.
Yeah. So it's basically just an obstruction in the esophagus. So the horse can typically breathe okay. A lot of people think that, or they're afraid that their horse is going to pass out. Most of the time, that is not the case.
They're going to breathe just fine.
Yeah. Most
They're
of the
going
time.
to breathe. I haven't seen them not breathe okay yet.
Yeah.
So the signs, symptoms of choke, and a lot of people, because it's pretty unnerving. The first time you see a choke, it's pretty unnerving. These horses they are coughing a lot. They got a lot of stuff coming out of their head and nose. Oh,
I'll give you a rundown of so I saw 3 chokes this weekend alone. 2 of them were at the same house. I'll give you a rundown of what the call sounds like from the owner. So the owner calls and says, hey, I fed my horse, an hour ago. And since then, the horse has been coughing, hanging its head down to the ground. Sometimes you can see all the muscles in its neck flexing, like it looks like it's trying to throw up, which horses, as everybody knows, that can't technically throw up. Which I have seen reflux pouring out of a horse's nose before, so that's
bad.
That's really bad. But I have seen that, but not technically throwing up. And then they have usually food or slobber, foamy, nastiness stuff coming out of their nose, and usually a lot of it. Yes. And they're usually hypersalivating. That's it. And then I'm like, yep, sounds like you got a choke going on, and I need to come out and bring my tube and my bucket of water and help your horse clear the choke. So basically we just use the tube and the bucket of water, and we get your horse nice and sedated, and we give it a couple drugs to make it feel better. And at the same time, I use my tube and water to kind of siphon out and help clear the obstruction out of the esophagus. So.
It's kind of a combination of siphoning and
a little bit of pushing and some siphoning, and
like using the pressure of the water to kind of break it up and push it through. It's similar to if you've ever had like a drain line jetted. It's a similar kind of thing. We're trying to flush things through to the stomach. We're trying to pull things out through the siphon, trying to push it down with the tube. It's an ordeal, and most people are terrified when this is going on because it looks pretty miserable, but there's really no way to do this.
We don't really have another option other than tubing them and clearing the choke. So a lot of people that call say, well, I've always heard that a choke was not an emergency, and that is definitely not true. So chokes are an emergency, and the reason being, I've had to educate a lot of people on this. Like, if you see a horse choking, call me right away, because the choke itself, like the esophageal obstruction itself, sure, if it's sitting there for only maybe an hour or 2, is not the issue. But what the real problem is the aftermath of the choke. The worst thing that can happen is, so they can get, biggest thing is aspiration pneumonia, because all that junk coming out of their nose, some of it.
And a lot of people don't know about this, and it's kind of interesting when you look, the esophagus, if you go to the upper airway, it sits right next to the trachea.
Yeah.
And you have this thing called an epiglottis. And so the epiglottis, the airway closes, what we call the arytenoids. They close together. The epiglottis flops up over it to keep stuff from going in, and food actually goes over the top of the trachea into the esophagus.
Yeah, exactly.
So when food comes out, it goes back over the trachea.
Exactly.
And if the epiglottis isn't down, a little bit of that food actually goes into the trachea.
And then they get aspiration pneumonia.
Yes.
So that's like your number one thing that we really worry about. And the longer the horse is choked, the higher your risk of aspiration pneumonia shoots way up. And then now your horse, even if we clear the choke, now your horse has pneumonia a week later and is very, very sick.
Yeah, and these aspirations, we got food particles in the lungs. This is not
They're gross.
Good.
They're very sick.
They're not good.
Yeah.
And then also the longer it sits there, you can actually get, because the esophagus is squeezing, trying to push this thing through. And like one of the medications we give is actually an antispasmodic.
Yep.
But it's trying to squeeze this through, and it's putting a lot of pressure on it, and the esophagus can actually squeeze to the point where it damages itself. And the esophagus they don't like to heal. They lack a layer they lack a submucosa. So typically you've got the mucosa, which is the very inside of that esophagus. Underneath that's the submucosa. That submucosa, that is the unsung hero of the GI tract. That's what allows us to be able to do surgery. And so that's the problem with esophagus is they don't like to have surgery. Like they don't do well on surgery because they don't have the submucosa that like glues back together and forms that seal. And the same thing can happen when that choke sits there too long is this thing will actually start to necrose and fall apart.
Yeah, that's like if the horse is choked for a long time.
Yeah, a while.
And usually more than a couple of hours.
And that's usually when we got something hard in there like apples, carrots, the certain feeds that like to clump together. We'll talk about that in a little bit, but But yeah, this is you're right. This is something. Call and we're coming. There's some things that may be a wait and see. This is not on that list.
Well, the sooner you call us, the sooner we get out there, and the choke is not a big deal. We pass the tube, we get the choke cleared easily, and we gently just kind of help pass along the food, or we siphon it out. The horse moves on with life, and we educate you a little bit on how to prevent choke, and everybody moves on with life. Versus if your horse is choked for 12, 24, this weekend in the case of 36 hours of being choked, now we got really big problems, and your horse has not only been able to, because your horse cannot eat or drink the entire time that they're choked, because they have an esophageal obstruction, aka nothing can go into their stomach.
Tube is plugged.
The tube is plugged.
Well, and I think a good thing
that horse
was
very colicky because massively dehydrated and is starved.
Well, and I think a good thing to remember is some of these horses, there's two places they choke. Right up top, right where the food goes into the esophagus, up what we call the proximal part of the esophagus. The other part is down what we call the distal esophagus, which is where it goes into the stomach. And one of the things that can happen, and this is where horses get a little sneaky on us, they kind of fool us. They'll do all this stuff, and they got all this feed coming out of their nose, their head's down, hypersalivating, and then all of a sudden it gets better.
And then they quit. Yeah.
And everybody's like, oh, it's resolved. Well, maybe, but a lot of times what's happening is that obstruction is moved down the esophagus, and now it's sitting right by the stomach. And you don't catch that one until hours later, because all of a sudden, like, oh, I'm better. Well, they start eating. Well, now we got this obstruction down here by the stomach. And then feed material just starts packing up behind it. And now we got an esophagus full. So even if you think like, okay, it's resolved, everything's passed, get your vet out there, have them pass the tube, make sure this thing goes into the stomach, because like I said, they'll fool you. They're sneaky. That's why if I get a call and people are like, oh, it's cleared, that's great. Let me still come out, because it may have just moved down the esophagus.
Right.
So.
And then, my other point was going to be aspiration pneumonia, pressure necrosis from the choke, and then colicking if they're choked for long enough. So, which was in the case of the third choke that I went to. So that horse was pretty colicky and dehydrated because she hadn't been able to eat for a really long time. She was very sad.
Yeah, so just I think, and I think What I like to talk about, we've got the aspiration pneumonia component, and so that's one of the things. Once we get out there, once we've cleared the choke, your vet's going to talk about we need to get an antibiotic on board.
Yes.
And that's a good preventative. And like I said, this is still, just because the choke's resolved doesn't mean everything's done. Life's great. It can take up to 3 to 4 days before you'll see signs of an aspiration pneumonia, and you'll also takes about 3 or 4 days before you can see where this esophagus has necrosis. It can be about 3 or 4 days before we see that.
Mm-hmm.
So your vet's going to talk to you about these things, and like, all right, we're going to be monitoring temperature, and we're also going to be monitoring breathing rate or respiratory rate.
Mm-hmm.
And so if we're a couple days out, see that respiratory rate spike, aspiration pneumonia is top on our list.
A lot of times I see coughing.
Coughing.
Yeah, a lot of coughing.
Yep.
Even that one, the second choke that I saw this weekend, she was already coughing, even though the choke was mostly cleared by the time I passed the tube. It was super easy, like it was still just a little bit stuck, but I was able to kind of easily get in the stomach. She had mostly worked through the choke herself, but she was already coughing, so I was glad I was there because I could go ahead and get her started on antibiotics.
And aspiration pneumonia is also one of those things, like the sooner we get to it, the better. So again, like let's say Monday night you have a choke, and then Thursday you're like, we're coughing a little bit, our respiratory rate's up. If you got a thermometer, take a temp. If you don't,
yeah, her temp was already up, and her blood work, her white cells were already up, and I was like, and she was only choked for about maybe 8 hours, and she was already fevering, and white cells were up. So, I mean, she could have possibly been choked a little bit longer than that. So.
Yeah, so we see that again. We want to attack that early.
Yeah.
Because aspiration pneumonia, I probably put it as the number one worst pneumonia we see.
Just because all the food.
Yeah, you're dealing with foreign material in the lungs. You're dealing with some crazy infections.
Moldy, like nasty stuff. Sometimes,
so aggressive treatment early. There's a theme here. Aggressive treatment early. I'd say that choke in general. Everything is a hurry up. Let's go.
So what we've been talking about, these are all acute cases of choke. What about chronic cases of choke?
Repeat offenders.
Yes.
All right, so
what happens if your horse does it 2 times, 3 times, 4 times? Why would that happen, Dan?
Well, there's a couple things, and I think the first and most common thing we're going to talk about, if you're having like the first time your horse chokes, what's the first question? I know the first question I'm going to ask is, when were the teeth floated last?
Well, yeah.
That's question number one.
How old is it?
Yeah.
Well, and what are you feeding, and when were the teeth floated last?
Because if you've got poor dentition, if your teeth are not able to chew correctly, you end up swallowing. Oh, boy, I slipped back in my Georgia right there. Oh, Lord.
He's swallowing.
I went back to my roots. I've worked hard to get away from those roots, but my roots, I'm over here swallowing.
That Augusto is coming out.
I'm telling you, it got thick. So it's kind of like your mama told you, chew your food well before you swallow.
My grandma told us to chew 1,000 times before you swallow, which I thought was
Lord.
That was excessive. I thought.
I'm going to get 6 most of the time. So you've got to, if your horse's teeth are bad and they're not chewing appropriately, we're not going to grind that feed up.
Or if your horse has no teeth left.
Or has no teeth left. We're not going to grind that food up the way it should, or they're not, and it's going to lead to increased risk of choke. So one thing to know, when we're at the choke, we're not going to float your horse then. This is a bad time.
We don't do emergency dentals.
Well, and it's just a bad time to float a horse. Let's let them get over this choke, and then we're going to float. So we're going to probably say, hey, 1 to 2 days, and it's also a great time to recheck those lungs. 1 to 2 days later, let's get those teeth floated. And that's also a great time for us to listen to the lungs, maybe pick up on early signs of pleural pneumonia and kind of see how it is. But we're going to want to float those teeth and do it. Just even an oral exam, you may say, oh, he had his teeth floated a couple months ago. We still need to probably do an oral exam because things can change. We may have a fractured tooth in there. We may have a diastema that's getting enlarged. I mean, who knows? Like a couple months can change a lot in dentition. So we're going to still want to look at those.
Missing teeth, those pockets, make it really awkward for them to chew in. Yeah.
The other thing is, what you're feeding.
Oh, this one is just such a little rabbit hole because there are a couple of things that I can think of where they are responsible for pretty much every choke I go to.
Beet pulp.
Beet pulp, alfalfa pellets, shavings.
Shavings. I have not had that one.
I've had like 8.
Really?
Oh, yeah. Friesians. They eat shavings.
All right, they don't
They're
count.
so bad.
We'll get into Friesians later. There's a whole nother thing. But
Friesians eat shavings. I don't know what's wrong with them.
Beet pulp and alfalfa pellets. I agree. Like, and 90% of the time, and here's the thing: most equine senior feeds are beet pulp based.
Yeah.
And here's the problem.
It's the beet pulp in the senior, and it just swells so well.
Well, and that's the thing to remember. It's not the beet pulp itself that causes the problem.
It's the dehydrated.
It's the dehydratedness.
Yeah.
So this is, if you think about if you're eating something dehydrated, if you're not chewing it appropriately, you're not mixing saliva with it.
Imagine trying to eat an entire bowl of mini wheats with no milk in it.
Good example. Good example. Because if you're not familiar where beet pulp comes from, out west they grow sugar beets, and there's these they look like huge taters, or huge potatoes.
Man,
I'm sorry,
he must be tired.
It's a tater. I'm sorry, I'm just gonna own it. I never could adjust over. It's a tater. They got these huge taters. They look like these really big taters, and they pull them up. They extract all the sugar out of it. And part of that extraction process leaves this, or then the pulp comes out sort of wet, but it would mold. So they're going to dehydrate it. And when I say dehydrate it, this stuff is like Sahara Desert dry.
Also, they dehydrate it because it's cheaper to ship around the country. Like if you don't want to ship water weight.
Right. And water molds too.
Yeah.
So between the two of them,
when
I say they dehydrate it, I mean, this stuff is.
I mean, you could throw it in the wind and it would blow away.
Yes.
Yeah.
It's dry. And so when that happens and it gets stuck, water gets in it, it swells, and then it turns into turns into like bricks in there. I mean, it is
beet pulp chokes are my least favorite. I am there for 4 hours.
Yes.
Because you can't be rough when you're clearing a choke because you could rip the esophagus. You want to be very, very careful. We're not in there shoving the tube. I mean, when I say pushing, we're just being very gentle and we're siphoning and we're
slight pressure.
Pushing and we're siphoning. But a beet pulp choke, because those chunks are so thick, your tube is only so big around.
Right.
And those chunks of beet pulp basically take up the entire diameter of the tube almost.
Yeah, they get massive when they form they make their own pellets.
So you take them out one at a time. It is painstaking. I'm there for like 4 hours getting beet pulp out of this esophagus.
And it's the same thing with that alfalfa pellet. There's no moisture in this thing.
Yeah, no.
It's dry.
It's pulverized alfalfa.
Right.
But it is bone dry. And when you re-soak alfalfa pellets, you could put maybe this much alfalfa pellets in a bucket and this much water, and it would soak up every bit of it.
Same thing with beet pulp.
Yeah.
I mean, you could, if you need to dry up a swimming pool, dump a couple bags of beet pulp in there, and it will dry it up. A lot of times we use that oil-dried base, or not oil-dry, we use like this, I can't remember what it's called, but you put it out on baseball fields when you're trying to dry them up.
Yeah.
I'm going to bring some beet pulp next time it rains. But don't worry, this will get all that water out.
Don't you worry. I'm not saying that alfalfa pellets are bad. I recommend alfalfa pellets for a lot of my patients.
And not the same thing with beet pulp. It's not bad.
No, but we're just saying, please rehydrate them before you feed it to your equine creatures.
And rehydrating is not like 3 minutes.
No.
So you want to give it some time to soak all this up.
Lots of time.
And when you're done, you want you don't want it like swimming in soup on a normal horse, but you still want a little water left over. Like it's soaked up all the water it can. Just a little bit of water left over.
Yeah, and so. I like to let it. Okay, so here's the simplest thing for me to do, because I'm at work all day and I don't have the hours needed beforehand right before feeding. So what I do is I will make up soaked stuff and put it in the fridge 12 hours ahead. So I make the AM for the PM and the PM for the AM.
The refrigerator is key on that, because
I don't leave it out because it will go rancid or the flies will get to it. I just pop it in. I'll put my alfalfa in a bucket, put my plenty of water, I'll pop it in the fridge, and then it's ready to go for the PM, and I can just dump it when I'm ready to feed, because I don't have time to sit around for 3 hours before the PM feeding, because I'm feeding at 10 o'clock at night.
Right. It's about an hour to 2 hour soak to really get beet pulp. And that also kind of depends on what kind. To really get that soaked up. So same thing with alfalfa pellets. You want to, when you soak that alfalfa pellet, it needs to break up. It doesn't need to still be in pellet form.
The center of it will still be hard.
Yes.
And so if you don't let it soak for long enough, just basically the test I tell people, I'm like, if you reach your hand down in the bucket and grab a pellet up, you try to break it with your finger and the inside is still really hard, it hasn't soaked for long enough. And this adding water rule goes for any sort of, if your horse is a chronic choker, it's gonna apply for any dehydrated feeds. That goes for like hard pellets, any senior feed, because it contains a lot of beet pulp. So basically, if you have a chronic choker, I would recommend just soaking everything that goes in their mouth.
Yeah, they go on a soup diet.
Yep.
They need to go on a soup diet.
They need to go on the Meemaw and Peepaw diet.
That's it. The other thing that sometimes happens is horses will bolt their feed. They're taking big bites.
They either have like food aggression or they have food fear, like they're eating it so fast.
Resource guarding. That's the new term I learned, is resource guarding.
Okay, I thought that was like a dog term.
Well, it's a dog term, but I was like, hey, you know what? Let's kind of bring it over here. Let's do a little resource guarding.
I like that.
I just learned about it in dogs. So
basically, they are just like they've either been starved in the past or they're afraid somebody's going to steal their feed. Like they've been turned out with cows and they've had to like eat their food real quick.
What happens when you're feeding, usually when I see that happen, a lot of times this horses have been fed in pastures, like pasture feeding situations.
They've been fed with 10 other horses.
Right. Yeah. They're kind of low man on the totem pole. Yeah. And they've had to kind of be able to eat really quickly. And it builds that habit. So they're bolting their food. They're not chewing. And so there's some things you can do to slow that down. I know a lot of people say put rocks in there. I'm not a big fan of putting rocks in with a feed tub.
I've seen them break their teeth on it.
That's my concern. Yeah. I've seen teeth, because horses will then bolt the rock. And if you are going to use a rock, like, we don't want you to use like a cute little rock. I mean, we're talking about like a massive rock.
Literally, like a rock.
Boulder.
I've seen people put big bricks in there too. Yep. I've seen that.
One of the things I really like, and I wish I knew who made them again. I looked it up one time and I should have done it before, but there's a company that actually makes these really big feed tubs.
And they have the little maze in the bottom.
Yeah, it's like little dimples in the bottom, or little mazes. And when you put the feed in, it scatters into those dimples, and they have to get it out of the dimple, and it just kind of slows down that consumption rate. So that's another great trick for if you got a horse that wants to bolt its feed and eat really quick, is use those dimples. One of the other things I've seen, and it works quite well, is they'll take and put a little bit of hay and then put the feed on top of the hay. And that way it's harder to get that big mouthful of feed, because they've got to eat it with the hay. Yeah. So. And
in my horse's case, he's not necessarily a chronic choker or anything like that. I just feed him wet food because I go to so many chokes and colics. I recommend to many of our clients, actually, if your horse will eat his food wet, it is not a bad idea to just feed them wet feed. Like, there's no downside to getting more water into your horse.
No, I've never been like, oh, he's overhydrated.
I think it is very, very hard to overhydrate a horse feeding them water. Like, you can do it with IV fluids, but feeding oral water, like, I don't think.
It's kind of tough. It's
very, very hard.
Kidneys are awesome.
It's very, very hard. And so I'm like, if your horse will eat wet food, there's a lot of benefits to it. So I highly recommend it.
The other thing is, when, a horse can choke every so often, but if we get into like this is a chronic recurring problem, we're going to talk to you about, let's do an esophageal scope.
There are a couple of medical problems that actually could be. So a couple of things we were talking about are behavioral and maybe some management things, like you've been feeding some dehydrated feed, but there are actually some medical reasons why your horse could be choking, aside from the teeth. So. Right,
aside from teeth. And that's what I'm going to talk to you about, an esophageal scope, because we're going to go down and look at the esophagus. We're going to look for strictures, and we're also going to look for masses and diverticulum. Diverticulum is like big, like outpouchings of the esophagus. Esophageal scope, it's not invasive. In fact, it's less invasive than clearing the choke.
It is.
So we're just going to give a sedative. We're going to pass an endoscope, go all the way into the stomach. Once we get to the stomach, we're going to look at the esophagus on the way out. We're going to pump a little air in, and we're going to look at motility. So we're going to make sure the esophagus is contraction. There's something called peristalsis. And peristalsis is this rhythmic wave-like flow that moves food down the esophagus.
Looks like an inchworm, basically.
And there's some medical conditions that there's an issue with that peristalsis, and they don't move feed like they should.
It's called megaesophagus, and it's actually a genetic condition that is found in Frisians, particularly. Yeah.
Yeah, and what can happen is they'll get these diverticulum we're talking about, which it almost looks like a second stomach down there. Like we've gone in and scoped, and we think we're in the stomach with the scope, and realize, nope, we're in the esophagus. The most common spot is right before you go into the stomach. So before we get to what's called the cardiac sphincter, there's like this big, huge lake.
Well, what happens is the lining of the esophagus becomes really weakened, and then you get a little bit of feed stuff in there, and then it gets weaker and weaker, and that little bit of feed stuff gets heavier, and it stretches, kind of like if you had like gauges in your ears, and you slowly stretch it and stretch it and stretch it until you have this giant diverticulum, and it looks like a lake, and it's pretty wild.
Yep. So that
also, we found one in a Frisian.
We did. Frisians have issues with their esophagus. So
they have gastric impactions.
They kind of run the. There's anything bad with Frisians, but if you have one, you need to know that these things can exist.
You need to be aware, especially if you have a chronic choker.
And it's not just Frisians. It can happen in other breeds. It's just more common.
Found one in a paint horse.
Yep.
Yep.
So the other one's strictures, and this can happen if you've had a chronic choker.
Where that food was, remember earlier we talked about if the food was sitting in a certain spot in the esophagus for long enough where it caused that pressure necrosis, where in that very specific spot of the esophagus, it actually damaged the lining of the esophagus. If that occurred, then it can actually scar down in that spot and cause a stricture. So then next time the horse goes to choke, now you have an area that is skinnier than the rest. You have a bottleneck now in your esophagus, which is now going to set you up for even more chokes and even more problems. So.
And it's interesting. The ones of those I've had, I've passed the tube and cleared the choke, but it's like I just can't get the tube to pass.
Stuck.
Yeah, you get stuck. And the same thing, diverticulums and strictures both. It's like the tube gets stuck. And that's when your vet's going to talk to you, like, they're going to come out with the tube, like, all right, we need to get a scope. And so a lot of times we're going to ask you to come into the hospital so we can get a scope in there. And we can actually see what's going on. And that way, and the good thing, too, is if we're trying to make sure the choke is cleared, a tube, it's just kind of passing and you're just pushing it down. You've got little control at the end of it. If we've got an endoscope, if we do hit a stricture or we do hit a diverticulum, because we can see and have control in the end of the scope, we can navigate past that. And we can navigate past, and then we can keep going and make sure like this did clear. Because there are times where I feel like I've gotten it cleared, but my tube just won't pass. And that's when I'm gonna safety up here. Like, all right, we have scopes. Let's go get one and let's.
Well, yeah, if the tube is just not passing, for the safety of your horse, you do not want a veterinarian that is just going to shove the tube. Like, you just be like, oh, my tube's not passing, and they just get very forceful with the tube. You do not want that. That can be dangerous. So what he's saying is he's just going to say, you know what, we're not going to force this tube. We're going to back out. We're going to go get a camera.
Yes.
We're going to go get the camera and see what the heck's going on here. We're going to go get the scope. I can see with my eyes what is the problem.
Yeah, this reminded me, though, Lord, this was, it's probably 12, 13 years ago. We had this choke. It had kind of cleared, but we couldn't get the scope past it, or couldn't get the tube past it. And I was like, all right, back up. Let's bring this horse in. And let's get a scope out. Let's get a camera. Let's go see what this is. So drive in, and there's this weird stuff on the screen. It's like spider web looking. I was like, what is that? And so then I keep working around. All of a sudden, lo and behold, there's a fish hook.
Oh, what?
So I look over, and all I can see is like where you tie your fishing line. I mean, and the webbing I was seeing was fishing line. And go back.
That is wild.
And had this, you could see the eye of the fish hook. The rest of it's actually embedded in the esophagus.
What do you do?
So that's the thing. Like luckily, and this is where luckily, the eye was pointing towards the stomach. So when it went in,
you can push it down.
No, it couldn't push it down because the hook is buried in the lining of the esophagus, like the pointy part. So Dr. Fuller was actually on this case when he was still doing equine. And so we were trying to figure out what to do. And I was like, I think the only thing we can do is we got to pull this out. And so we actually we used fishing line to solve the problem. And so we doubled over fishing line, some monofilament, pushed it through the scope till it formed a loop. Once we got in, we laid the loop over the end of the fish hook and then pulled the bend of the hook up to the scope. And like I said, luckily it was in a direction so that when we pulled, it just came right out of the esophagus. And when we're in there, everything looks bigger on the scope. So we're thinking like a little brim hook. This is huge number 2 saltwater hook. And the crazy part was there wasn't a lake at this farm.
What in the world?
There was no place to fish on this farm. It's not like somebody messed up and left a fish hook laying around. And literally, there's this number 2 saltwater hook, complete with fishing line. Pulled this massive number 2 salt. Like when it comes out of the horse, like I said, we were expecting a little bitty tiny like brim hook, and it comes out, and our eyes got huge. She was like, "Are you kidding me?" Because I mean, this thing was massive. It was like a number 2 saltwater hook. Like, let's go catch a massive
dang.
Let's go catch some redfish with this thing.
Wow.
So yeah, that was, and again. Dr. Fuller was actually on the case. He's the one that passed. He's like, something isn't right. Brought it in, got the scope out, went in to look. We were expecting like a diverticulum or something, or a stricture. And no, it was a fish hook.
Sometimes you just need a camera.
It was.
Yep.
And I hated it because the scope we had at the time, you couldn't record video.
Dang.
You could do
it was the one where you look through the.
No, it was still a video scope, but it was one of the very early ones where saving pictures wasn't as easy to do. So this one didn't save pictures and it didn't save video. Dang. So luckily, one of the techs was over there with her phone and grabbed some pictures of the screen, but. Dang. And we kept that fish hook forever. I don't know where it ended up, but that was
that's cool.
That was a case where the camera wins, right?
Yeah.
Because if we had, and the horse went on and did perfectly fine.
That's really cool.
And that was the other lucky part too, is because it was a saltwater hook. Luckily it wasn't a circle hook, and it was a barbless hook. And so all those things really worked to our advantage, and we were able to pull this out.
That's really cool.
So. Yeah, I just remember that. So,
that is wild.
Moral of the story, when in doubt, get a camera.
Yep.
Get a camera. We've got a bunch of those. And
if you have a chronic choker, we're probably going to be getting the camera.
We're going to get a camera out. We're going to get a camera. Because once you know, we can do something. And I think that's the biggest thing, chronic chokers.
Even if we find nothing, at least you can say, well, I don't have a medical issue here.
Right.
Yeah.
And so then it says, all right, we just got to keep working on our management and getting that right. I've had a handful choke on grass, not many. I think. No,
mine was mostly surrounding around feeding.
Yeah,
I think I've had maybe one that had hay, like chunks of hay. But that was it. They're really few and far between.
I think the ones I've seen that had hay, there was still some feed behind it that started this.
Yeah.
Because like I said, those are mostly the ones that they think have cleared, but it's just pushed down further. And now that blockage is lower in the esophagus and the horse feels better, so it starts to eat a little bit of hay, and then the whole process starts again.
Yeah, agreed. So. Agreed, for sure.
But yeah, apple cores are the worst.
Oh my gosh. Well,
apples are the worst.
If your horse has no teeth, we had a.
How about just in general, small bites of apple, whether they have teeth or not?
Well, yeah. So we had that horse that was almost died from a chunk of apple. Bless him. He's doing great.
Yeah, he's doing good.
He's doing great.
So what we're saying there is they can, if they don't chew, like if you give your horse apples, if they don't chew them well, now you have this hard piece of apple lodged. In the esophagus. We're not siphoning that out.
You literally can't.
We're not.
We had one option to push it out.
Yes. That's one of those times.
Push it through.
Where we drive through down with a scope, realize we're dealing with apple, or apple, pear, something that's like that, something that's solid, and we have to tell the owner like there's only one way to get this out, and that's we have to push it through to the stomach because, like I said, because that esophagus does not have a submucosa. Trying to sew it back together, doing an esophagostomy is incredibly risky, incredibly difficult.
Well, he's a very, very old man. The horse is. He had no teeth. This was Dr. Caitlin's case.
Yeah.
And I think April was there helping her, and they went back 3 times, I believe, 3 or 4 times to help him over the course of a couple of days. And he pulled through, thank goodness. They finally got the piece of apple out, but it was a very, very close call. They spent 6 hours working. They basically stayed with him overnight trying to work on it because you have to be gentle because he's very old and his tissue is very friable and you don't want to force anything. But yeah, chunks of apple can be dangerous, and it was a complete mistake. There was just a little girl that was trying to be very sweet and give him some apple. It was nothing that was mean or nothing, no ill intent or anything like that. It was just a freak accident. Nobody could have ever assumed that something like that was going to happen. So just beware that chunks of apple, small carrots, the baby carrots, that can be very dangerous as well. So just keep these things in mind.
Right. So if you're dealing with that, cut your apples up, cut them into slices. Let's save the choke. Little piece of apple. Let's go that route.
Yeah.
Big fan of that. And like I said, carrots. That's important because, like I said, horses. You want them to chew their food, but sometimes they just don't. They get so excited about the next bite. They're like, I'll swallow this one so I can get another.
Or if they have no teeth, applesauce.
Applesauce, yes. Bananas.
Watermelon. They love watermelon, actually.
They do. They do like watermelon.
And lettuce, strangely enough. They do like
really?
lettuce. Yep. Weirdly.
Did not know that.
Don't you remember Sir Edward?
That is true. Iceberg lettuce. He
lettuce.
Did like his lettuce. That was like his favorite. That was his treat.
He would eat a whole head of lettuce a day.
He was insulin resistant, and while I was here, we couldn't, because of his insulin issues, he couldn't have treats. So
I know a lady that would roll up cucumbers. She would put the meds in the cucumbers, make it like sushi, little med sushi
meds. So yeah, I think I think the biggest thing on chokes. Give us a call. Give your vet a call.
The sooner we get the choke cleared, the better for the horse.
Proactive management. I really think that's important. This is where that what's that saying? An ounce of cure is worth, or an ounce of prevention
is worth a pound of cure.
Yeah. So we're going to work to prevent. So, that's the other thing is when your vet's out there and they're floating teeth, if they start talking to you, especially if you got an older horse, and they start talking to you like, hey, your teeth are starting to expire, or which means we're running out of tooth. When they make these comments, you want to think, okay, let's go ahead and be proactive.
I think it's time to start soaking his food.
Right.
I think it's time to start, being proactive against choke here. Yeah. Especially if you see signs of a sign that your horse's teeth are aging and or your horse's teeth are having an issue. One of the first symptoms can be that you're seeing quitting happening, which is your horse is making little wads of hay and dropping them on the ground, like little balls of hay. If you're finding those around, that can be a sign, hey, maybe I should call my vet and have the teeth looked at. My old horse's teeth are maybe getting old, or if the vet's already been there to float your horse's teeth and it's still doing that, then the teeth probably are definitely at a phase where you're at a higher risk of choking. You should probably be soaking the horse's feed.
Well, another thing, if we're dealing with these chronic chokes because of the dentition, this is where that once a year float may go to every 6 months.
Oh, absolutely.
May go to every 3 months. And I promise you, no matter how much you think a dental float cost, it is still cheaper
than one emergency choke. One emergency choke, you could pay for 4 dentals that year.
Right. And plus it's less stressful on your horse, and it's better for your horse. So listen to your vet if you're like, hey, we need to get here we need to recheck this horse in 6 months. We're trying to prevent this choke. We don't want your horse to go through this.
Right.
We don't want them going through this. And again, chronic chokers, go ahead and get that scope in there. Find out what's going on. Know if you have a medical issue or you don't. One of the things that we forgot to mention is if you are in a group feeding situation and your horse is one to try to bolt its feed, let's take him outside of that pasture. Take
him out of the stressful situation.
Right, and let him eat a little slower.
Yeah.
Because let's don't build that habit.
Yeah, so. It's as I know sometimes it's not possible in certain situations, but it's really not very difficult to make little sections out in a field to feed horses separately. If they're all turned out together, like 10 horses are out in a field together, it's really not very hard to set up small little areas where horses can eat separately, and then when everyone is done, they can go back out together. It's actually, you can do it quite cheaply. It's really not that hard, and then everybody is much safer and a lot less stressed out, and you will have a lot less injuries and problems, because injuries can occur when they're trying to attack each other and steal each other's food.
Well, and the other thing to remember is if you are having to soak your horse's feed and they're in a pasture
it's
environment,
going to slow them down too. Yeah,
they're in that pasture environment. Well, everybody's going to have the feed soaked, because I know we all think like, oh, we feed them in this pan and that's the only place they're going to eat. I've watched this. It's musical feed pans.
They all swap around.
They just, because they always think like, oh, I bet his food's better than mine. And so like, I'm going to go get his food. They're going to move around.
Well, and the lead horse is the one that determines that. So if the lead horse wants your food, you got to move. Mm-hmm. Like it just, they swap all the time.
Right. So it doesn't matter if your horse is low man on the totem pole, mid-range, or high man on the totem pole. If he thinks somebody else's food's better, he's going to go for it. So if you're going to feed in the pasture, that means if your horse's feed needs soaked, one horse feed needs soaked, you've either got to remove that horse and let him eat outside his soaked food, or everybody's got to have it, or else we're going to be right back here again.
Same goes for any fancy supplements or special feed that your horse may need. Mm-hmm. If your horse needs all that, you probably just need to separate them to feed them, because your horse ain't going to be getting all that.
Yeah. Yeah, and the other thing to remember, too, we've talked about molars, and we've talked about sharpness of molars, but we forget about the oral resorptive lesions. I always get the abbreviation wrong.
EOTRH?
Yes. Mm-hmm. I always like ERO. I have to write it out to make sure I get all the letters where they're supposed to be.
Yep. EOTRH.
Yep. Equine oral resorptive lesions and hypercementosis. This is an issue with the incisors, and they become very painful. Mm-hmm. And those horses will also not chew well.
They usually eat very slowly.
Very slowly.
Because they're trying to be very tender with their mm-hmm. So it's a very painful issue that occurs with the horse's incisors, and therefore those horses won't bolt their feed. They actually do the opposite. They usually eat real slow and tender. But they don't like to chew. Yeah. And that's where I see, like, if they're on a pelleted diet, that's where I typically see those, is mm-hmm. because they are eating smaller bites, but they're not chewing the pellets. Mm-hmm. And those pellets hit the esophagus, and when that happens, it swells and causes a choke. So it's not just sharp points, it's not just molars. Mm-hmm. It's the entire mouth that you have to look at. Yeah. So, all right, we're going to hit a quick summary. If you got a choke, call the vet. Don't wait, call the vet. It is an emergency. Yes.
And just because the choke's over doesn't mean life is good. I'd probably say 90% of the cases when the choke's over, we're good. However, aspiration pneumonia is still a real issue. We have to be ready. We have to be paying attention for that. I would
say for about at least a week after your horse chokes, you want to be watching your horse, making sure that it doesn't show signs of colicking, and making sure it doesn't show signs of respiratory distress. So that would include increased respiratory rate, coughing, stuff coming out of his nose again. Mm-hmm. Fevers. Yeah.
Fevers, anything north of 101.5.
Yep.
Above 101.5, we have a fever. So 101.7, that's a fever. Mm-hmm. We don't have to be 103 before we call it a fever. North of 101.5, it's a fever. And if you're wondering how to take your horse's temp, just a regular old digital thermometer. You can pick them up at any pharmacy anywhere. I prefer the ones that are made by Vicks. Mm-hmm. Vicks actually makes a thermometer. That's my preferred, because mm-hmm. I'm over 40. So the bigger numbers.
They have a big screen.
The bigger numbers are really, really awesome.
Yeah.
I don't like the mercury ones because I've always heard, well, they're more accurate. I'm pretty sure by the time I take it out and twirl it in the air for 30 minutes trying to find that line in there that I can't see anymore, I don't think it's going to work. So a good old digital thermometer, pick them up at any local drugstore.
Yeah, I like the little fast read digital thermometers, and you just go rectally, and I just go in as far as I can, basically up to the screen.
Mm-hmm. Push the little button when it beeps, there's your temp.
Mm-hmm.
So really simple to do. Have a couple of them. That's the thing I like about the Vicks. They read fast.
Always have two, because sometimes your one thermometer can be wrong, and you always want to double check it.
Mm-hmm. Have two. So those things you want to watch for. When in doubt, get a camera.
Yeah.
When in doubt, seeing is believing. So
one choke, maybe we're not going to grab the camera unless if something really weird's going on. But definitely if your horse is choking more than once, I'm like, okay, repeat offender, you're getting a camera usually.
Here's where I listen to. If the owner goes,
unless if you feel like there's a fish hook in there.
Yeah.
I'm like,
if it's choked enough where you're calling, you're like, old Leroy, he's choking again. If you use the word again, or your vet, like you call and say, Leroy's choking, the vet goes, again? If the word again shows up in this conversation, we need to be thinking about a camera.
Yeah.
Because that means we all remember this, which means this happened a little too much.
Yeah.
So remember, if you're using the word again, or your vet says the word again,
or if we're passing the tube and we're like, things don't feel right.
Get a camera.
Yeah.
Get a camera. It's not expensive. Just get the camera.
Yeah.
Again, prevention is everything. Soak and feed, making soup, getting a dental done. Cannot stress this enough. Check the teeth. Most common cause of a choke is poor dentition. Second most common is not properly prepared feeds.
Yeah.
So make sure try to prevent bolting of feeds, those sort of things. So. Mm-hmm. But that's a great episode. I'm glad that came up because we cover a lot of things in here, but we had not covered choke before, and I'm glad we did because that's a common emergency we see.
Well, it just came to me while I was driving to work the other day because I saw so many. In some weeks, I feel like I see like 40 in a week, and I'm like, I have had enough of this.
Yes.
I have had enough because choke is one emergency that I feel like is very largely preventable.
Right.
Very, very largely preventable. Not completely preventable because there are medical anomalies here and there, but at least 80% of the chokes I go to could have been prevented.
Right, and preventing this is a lot less stressful on your horse. It's much easier on your horse. So this one time being proactive and preventing is a great thing to do. So well, thanks for being here this morning, Dr. Zoe. We really appreciate it. April, thanks for doing all the technical stuff where we hook up all the wires. Casey, great job editing. Y'all, it takes a team to put this on. And
thanks everybody for listening in.
Yeah, I was going to say, and most importantly, thank y'all for listening. Found out I think we're in 59 countries now.
Cool.
I don't even know where all these countries are. So.
I get people telling me like almost every day, like, oh, we love your podcast. And I'm like, oh yeah, I forget we have a podcast. And then I'm like, yeah.
It's something I really enjoy doing it. It's a lot of fun.
Yeah.
We really appreciate y'all listening and sharing your day with us when you do. So if y'all have got questions, again, we've got a huge list of topics. We're trying to work through them all. Can't get them all at once, but y'all keep sending in ideas. We got a big whiteboard where April keeps everything written down, and we're on to like whiteboard number 2. We're going to keep cranking through these. We really enjoy it, having a great time. So we really appreciate it. Y'all keep sending in your requests, and we'll keep trying to work through them and have a great day out there. It's finally springtime.
It's supposed to be like 80 today.
Yes.
I'm so excited.
So get out there, go enjoy your horses, have a great time, and we will see y'all next week.
Thanks,
y'all.
Guys.